Welcome to Boxed in Health, where knowledge and wellness converge, sparking transformative journey to a better you. Today, we uncover the topic of postpartum depression. Giving birth is a challenging and draining experience. During pregnancy, a woman undergoes significant hormonal, physical, emotional, and psychological changes. These changes profoundly impact her family and social relationships. After giving birth, a mother can experience a wide range of emotions, from happiness and joy to sadness and frequent crying episodes. This period of sadness and tearfulness is commonly known as baby blues, and it typically subsides within the first 2 weeks after delivery. Approximately 1 in 7 women may experience postpartum depression, PPD. While those with baby blues tend to recover relatively quickly, PPD can be prolonged and significantly impede a woman's ability to resume her normal routine. PPD not only affects the mother but also has a profound impact on her relationship with the newborn. The mother's brain response and behavior are compromised during PPD. In rare cases, an extreme mood disorder referred to as postpartum psychosis can develop after childbirth. This condition is defined as a major depressive episode that starts during pregnancy or within 4 weeks after giving birth. The signs of baby blues, typically lasting a few days to a week or two following your baby's birth, can encompass fluctuating moods, anxiety, feelings of sadness, irritability, sensation of being overwhelmed, tears and crying, difficulty focusing, changes in appetite, sleep disturbances. Postpartum depression can initially be confused with baby blues, but its symptoms are more intense and persist for a longer duration. These symptoms can significantly disrupt your ability to care for your baby and manage daily responsibilities. Typically, these signs manifest within the first few weeks after childbirth, but they might start earlier, during pregnancy, or later, up to a year post-birth. Indications of postpartum depression encompass persistent feelings of sadness or severe mood swings, excessive crying, struggles in forming a strong bond with your baby, withdrawal from family and friends, changes in appetite, either reduced or increased, difficulty sleeping, experiencing either insomnia or excessive sleep, overwhelming fatigue and a notable decrease in energy levels, loss of interest and joy in activities you once found enjoyable, heightened irritability and anger, fear of not being a capable mother, feelings of hopelessness, thoughts of worthlessness, shame, guilt, or inadequacy, challenges in clear thinking, focus, or decision making, restlessness, severe anxiety and panic attacks, thoughts of self-harm or harming your baby, persistent thoughts of death or suicide. Left untreated, postpartum depression can persist for several months or even longer. The origins of postpartum depression are multifaceted, with genetics, physical changes, and emotional factors potentially playing pivotal roles. Genetics. Research indicates that a family history of postpartum depression, especially if it was severe, elevates the risk of experiencing postpartum depression. Physical changes. Following childbirth, a significant decline in estrogen and progesterone hormones in the body could be a contributing factor to postpartum depression. Additionally, a sharp drop in other hormones produced by the thyroid gland can lead to feelings of fatigue, sluggishness, and depression. Emotional factors. Sleep deprivation and feeling overwhelmed can make it challenging to cope with even minor issues. Anxiety about the responsibility of caring for a newborn, concerns about physical appearance, struggles with identity, or a sense of losing control over life are emotional challenges that may contribute to postpartum depression. Postpartum depression can affect any new mother, not just those with their first child. However, your risk is higher if you have a history of depression, whether during pregnancy or at other times. You have been diagnosed with bipolar disorder. Postpartum depression occurred after a previous pregnancy. Depression or other mood disorders run in your family. You've encountered significant stressor in the past year, such as complications during pregnancy, illness, or job loss. Your baby is facing health issues or special needs. You're raising twins, triplets, or had a multiple birth. Breastfeeding is challenging for you. You are experiencing difficulties in your relationship with your spouse or partner. Your support system is weak. Financial problems are a concern. The pregnancy was unplanned or unwanted. Complication. If left unaddressed, postpartum depression can disrupt the bond between a mother and her child and create challenges within the family. For mothers, untreated postpartum depression can extend for several months or longer, potentially evolving into a persistent depressive disorder. Mothers may cease breastfeeding, face difficulties in forming strong connections and caring for their infants, and experience an elevated risk of suicidal thoughts. Even with treatment, postpartum depression heightens the likelihood of future episodes of major depression. For the other parent, postpartum depression's impact can extend beyond the mother, causing emotional strain for all those close to the new baby. When a new mother grapples with depression, the risk of depression in the baby's other parent can also rise. Moreover, these other parents may already have an increased predisposition to depression, regardless of whether their partner is affected. For children born to mothers with untreated postpartum depression are at a higher risk of encountering emotional and behavioral challenges, including disruptions in sleeping and eating patterns, excessive crying, and delays in language development. If you have a history of depression, especially postpartum depression, make sure to inform your healthcare provider if you are planning to conceive or as soon as you discover you're pregnant. During pregnancy, your provider will closely monitor you for signs of depression. You might undergo a depression screening questionnaire during and after your pregnancy. Mild depression can sometimes be effectively managed through support groups, counseling, or other therapeutic methods. In certain situations, your provider may recommend antidepressants, even during pregnancy. After giving birth, an early postpartum checkup may be recommended by your provider to screen for signs of postpartum depression. Detecting it early allows for prompt initiation of treatment. If you have a history of postpartum depression, your provider might suggest starting antidepressant treatment or talk therapy right after delivery. Most antidepressants are considered safe for breastfeeding mothers. The diagnosis should encompass either experiencing depression or anhedonia, loss of interest, in addition to presenting 5 key symptoms. Feeling consistently down or sad, either self-reported or observed. A pervasive lack of interest or joy throughout most of the day. Challenges with sleep, whether it's difficulty falling asleep or oversleeping. Noticeable slowdown in physical or mental activity, or heightened restlessness and agitation. Feelings of worthlessness or excessive guilt. Persistent fatigue or a marked decrease in overall energy levels. Contemplation of suicide or making attempts, along with recurring thoughts of death. Difficulty concentrating or making decisions. Significant changes in weight or appetite, indicating a weight shift of 5% or more over 1 month. The approach to treatment and the duration of recovery vary based on the severity of your depression and your specific needs. If you have an underactive thyroid or an underlying health condition, your healthcare provider may address those conditions or refer you to a specialist in that area. Your provider might also recommend consulting a mental health professional. The baby blues typically subside naturally within a few days to 1 to 2 weeks. During this time, aim to get ample rest. Accept assistance from family and friends. Connect with other new mothers for support. Set aside time to care for yourself. Steer clear of alcohol and recreational drugs, as they can exacerbate mood swings. If you're facing challenges with producing milk or breastfeeding, consult your healthcare provider about engaging a lactation consultant for assistance. For postpartum depression. Postpartum depression is commonly treated with psychotherapy, also known as talk therapy or mental health counseling, medication, or a combination of both. Psychotherapy, discussing your concerns with a psychiatrist, psychologist, or another mental health professional can be beneficial. Therapy helps you develop better coping mechanisms, find solutions to problems, set achievable goals, and respond to situations positively. Family or relationship therapy can also be useful. Examples of therapies used for postpartum depression include cognitive behavioral therapy, CBT, and interpersonal psychotherapy. Antidepressants. Your healthcare provider might suggest an antidepressant as part of your treatment plan. If you're breastfeeding, it's important to note that any medication you take will pass into your breast milk. However, most antidepressants are considered safe during breastfeeding with minimal risk of side effects for your baby. Work closely with your provider to evaluate the potential risks and benefits of specific antidepressants. Other medications. Additional medications may be incorporated into your treatment plan as needed. For instance, if your postpartum depression is accompanied by severe anxiety or insomnia, your provider may recommend a short-term anti-anxiety medication. If you enjoyed today's video, don't forget to like, share and subscribe for more informative content like this. Thanks for watching. See you again with another video.